Okay. Anyway, so uh, so we are going to be starting with kinematics today, and you have a general overview of what happens during the movements and which are the movements that take place all along the spine. So, what you see in front of you is a table. I would not suggest that you should take the absolute values because there are the way they are stated in the table, because there are definitely going to be variations within the individual. There are going to be variations even between individuals. Okay, and that is why this is just for you to understand a trend in what happens from the upper lumbar to the lower lumbar spine. Okay. Now understand for a fact that we are looking at thicker IV disc, and but the ratio is still the maximum between the vertebral thickness, sorry, the IV disc thickness and the vertebral body height in the cervical region, making it the most mobile region. So if you will remember that aspect, the lumbar spine falls somewhere in between, and that is why it has an intermediate mobility when it is compared with the cervical and the thoracic spine. Okay, if we look at the facetal joint orientation, then they tend to become a little more coronal as we go down, like we discussed the last time. And thereby, if we think of it, the lower lumbar facets would allow more lateral flexion and orient and rotation. But that is not something that you see in here. If you see the diagram, still there is a lot of limitation in the L5 S1 region, and this tends to happen from the fact that orientation is,
Ma'am,
yeah.
ma'am, have you shared the screen because it's not visible?
No. I have sent you photographs because my PPT is not on the phone, and I have had to change and take the lecture from the phone.
Okay, ma'am.
Yeah, that is why I asked you, has everyone got the photographs? I have shared
Okay, ma'am.
the
Sorry.
slide with you, which I want you to refer to. Is anyone else
Yeah,
facing the
ma'am. Got it.
same? See, your CRs will have shared them already. Okay, should I continue?
Yes, ma'am.
Yes. What I was saying was, if you can see, with our logic of general biomechanics applied, we should thereby expect the side bending and rotation to be the maximum in the L5S1 region. But that does not happen, and basically this is from the fact that L5 and S1 facets are more coronally oriented, not in order to permit the movement in that direction, but in order to prevent the shear stress, which is the maximum in this region. Okay, we will be talking about that as we go to kinetics. So do not assume that the movement of lateral flexion and rotation would be better as we go downwards towards the lumbar region. In fact, this is more secure region because of the additional iliolumbar ligaments. And if you remember, the intertransverse ligaments also tends to get stronger as we go down. Okay, so all in all, the L5 is more securely attached to the S1 because it has to now transition into a more stable sacroiliac and the pelvic articulation. Okay, that is why most of the movement of flexion, extension, side bending, rotation is present in the L4, L5 rather than in the L5S. Okay, even if the thickest disc is present in the L5S1, that also has got more to do with the kinetics that we will discuss later. Okay, so if you see that there is a difference in the way movement takes place between each interbody functional unit, and there are different trends, and most movement of flexion sort of occurs between L4 and L5, and likewise with side bending and rotation, it is better in the upper lumbar as compared to the lower lumbar. Okay, you can forego the details, understand that there is going to be a variation even within the lumbar spine based on many of these factors. Also, some of the movements are also going to be affected because